Hello, I'm Ian Range, an APOS trained physiotherapist at the Reinge Clinic in Kenilworth, and today we're talking about how the APOS shoe can help with osteoarthritis of the hip. Now, if you'd seen our previous video about the knee, you'd have seen us talk about how moving these pods around to different settings on the bottom of the shoe can change the way forces run up through the leg. And of course, that can also work for the hip. Because you've got wear or damage on the cartilage, you've got areas of the hip in contact with one another that shouldn't be. And as we move these pods around, it changes the way your foot hits the floor. And that changes ultimately the way forces arrive at the hip. And normally we can find a setting that makes you able to walk without pain. However, with hip arthritis, there's more to it than just changing the way the forces go through the leg. We can also use these to train stability. And that's something we see a lot in arthritic hips, is a lot of instability. And that's achieved through different pods. Let me show you. We have several kinds of pods, but here we have two that are extremes. They're not massively different, but if you look carefully, they're different enough. This one is very flat. It's very inherently stable. This one is extremely rounded and it's a lot less stable. And if we place this one on the bottom of the shoe, it makes the shoe less stable, and that creates more work for the muscles around the hip, which develops the stability, develops the support around the hip, and develops the space, which again gives you a long-term relief of pain. And of course, it doesn't matter if you start with one of these. On the follow-ups, you can be changed gradually through the pods until you are at the hardest one. So, if you're interested in the APOS shoe, if you're interested in seeing if it can work to relieve arthritis of the hip, give us a call, get hold of us on social media, email us. It's completely free assessment. It takes about an hour and a half, and it will either resolve your pain or it won't. So, if you're interested, let us know. Take care.